nurses are great about talking to the public, but we're scared to talk to journalists and to go on radio and television. That's one of the reasons that I was particularly interested in replicating the Woodhall Study 20 years after the original study was done.
Tell us a little bit about the original Woodhall Study.
So the Woodhall Study was conceived of in collaboration with Nancy Woodhall, who was a founding managing editor of USA Today. And she was very concerned about women's underrepresentation in media. And she had a diagnosis of cancer, had care from nurses, and it occurred to her that, why aren't these fabulous nurses in the media, or are they? And what they found in terms of how often nurses were sourced in quotes, less than 4% of the time in newspapers, and 1% of the time in news weeklies like U.S. News and World Reports, Time Magazine, Newsweek, and in our own trade publications, healthcare publications. We were used as sources 1% of the time. In modern healthcare, it was 0.6% of the time. And this was despite the fact that nurses would have been more germane to some of the stories that were published, like the care that was involved of somebody with HIV/AIDS in the 1990s. Well, who was providing that care? Nurses. And so they were rarely interviewed in these stories. And if there was a photo accompanying the story, nurses were almost never identified in photos. We were never mentioned in articles on health policy. Mostly we were talked about in articles on labor and the nursing profession. And so it wasn't very encouraging news. With the Future of Nursing report coming out from the Institute of Medicine in 2010, 2011, one would think that that would have raised the visibility of nurses in the journalism community and that we would be used as sources more often. We have more doctorally prepared nurses, more nurses doing research, more nurses heading up healthcare institutions and responsible for healthcare services, whether it's critical care or oncology, what have you, public health nurses, et cetera. So journalists, why wouldn't they want to turn to nurses? And what we found is that nurses were used as sources in quotations across all of these publications 2% of the time. Now the difference was not statistically significant, and so we can't say that it's dropped. We can say that nothing has changed. But that in itself is such a sad commentary. So you can say, well, how accurate is this? We know that nurses are probably cited more often than we realize or can identify because of editorial styles. Most print and online publications use the Associated Press editorial style or a similar style where physicians are always identified as either Dr. Smith or John Smith, MD. It doesn't matter what role they're in. They could be the CEO of a hospital and they would still say John Smith, MD, or they would say Dr. John Smith. If a nurse with a PhD or a clinical doctorate is the CEO of a hospital, they do not put RN, they do not say Dr. Jane Smith. So you don't necessarily know that it's a nurse. And part of that is just editorial styles that haven't changed over decades. And so I think we have to hold those who do those styles accountable for give us the rationale for why it's physicians who are the only ones identified with a degree, the MD, or referred to as doctor, when there are other clinicians beyond nurses who hold clinical doctorates and they're Dr. so-and-so. So it's likely that nurses are represented more often than that, but not by a huge amount. And things have not changed appreciably. If anything, they've gotten a little bit better about identifying nurses over the recent years. Some of us sort of badgered the New York Times to change its editorial style on letters to the editor when the original Woodhall study came out. They would not put RN, they still will not put RN after my name, but they will say in the byline, Diana Mason is a registered nurse and whatever other affiliation. So we think that it's still unchanged from 1997, and we need to do something about that. We are still not cited around policy issues. We're still rarely, 4% of the time we're identified in photos. So there is a lot of work that we have to do.
Do you see any difference in gender?
Women are dramatically underrepresented in health news media and news media in general. Only about 25% of newsroom staff are women, despite the fact that the majority of students in schools of journalism are women. We know that women are used as sources in news stories in general, about 30 to 35% of the time. And so we're underrepresented as women anyway. Now, nurses are 90% women. Data that we have show that we don't even have parity as women in health news media. So something else is going on here. We added an additional phase to try to get a better understanding of why we're so poorly represented in health news media. So we interviewed 10 journalists and found that about their experiences with using nurses as sources in their stories and what they perceive to be the barriers and facilitators to using nurses as sources. And it was quite revealing. They do not understand, and they told us this, we are not sure of the many roles and the scope of work that nurses do. They understand nurse practitioners and the scope of practice issues there. But if you talk about a bedside nurse, they don't really understand the responsibilities and the authority of that staff nurse. They do not understand that that nurse who's taking care of that patient at the bedside is the hospital surveillance system for patients. That if that patient starts to go down the tubes, it's that nurse who's going to discover it. And if you don't have that nurse at the bedside, that patient will get sicker or can die, and we know that. So journalists need to have a better understanding of what the work is that nurses do. So it's really important that nurses get better at describing what they do. You've got to do a better job. All of us have to do a better job of describing what it is that nurses do and why they are so crucial at that bedside. We also have to talk with journalists about the difference in all our credentials. We are the only profession that will list 7 different credentials. And we've got to stop that, first of all. You can be certified, but you don't have to be putting it down in everything. You pick one certification, for heaven's sake. But you know, so maybe your degree, maybe your RN and a certification, but don't overwhelm people with your credentials. Explain to them what those credentials mean. And the fact that you essentially are board certified when you have that credential and what a difference that makes. So journalists said to us, well, we're not really sure about what nurses do, and we have interviewed some nurses, but it's about nursing. When it's a story about nursing, we know we need a nurse. If it's a story about healthcare, why would we interview a nurse? Or it's a clinical topic, why would we interview a nurse? So they don't understand that a nurse could bring a different perspective on what it's like to have cardiomyopathy. What's it like to be in the hospital and experience cardiomyopathy and the care you're getting? What's it like to have cardiomyopathy and be at home and functioning and have a nurse in your home working with you? So there's a lot that we have to do in terms of describing what we do and why our perspective's important. What journalists did say to us is that when they did use a nurse for other than a nursing story, it enriched the story. They got that. They understood that. But I want to say that they all seemed a little bit almost embarrassed that they weren't using nurses more often. It was almost a consciousness raising. And so it's not that journalists don't want to use nurses, they don't think about us, they don't understand us. And so we've got a job to do with the education of journalists. But they also told us that if they go to do a story and use a nurse, they sometimes have to justify that with their editor. They're never asked to justify it when it's a physician, but if it's a nurse, they have to justify that. So that's a bias as well. So newsrooms have their own biases, and we're hoping to raise journalists' awareness about the biases that exist there. But a couple other interesting points that they made. One was that when they don't know where to find nurses. And if they go to a healthcare organization like a hospital or a university with a school of nursing, and they ask to interview somebody on a health topic, they are never given nurses to interview. And even if they ask for a nurse, a specific nurse, or a nurse to interview a nurse in general, they may not be given a nurse. So we have work to do with our healthcare organizations and universities, saying, why aren't you offering us up as sources to journalists? We could bring a valuable perspective. The other is, they said that they never get press releases from nursing journals on the latest research they're publishing, or from schools of nursing about the research that's coming out, or from nursing associations on something extraordinary that's going on beyond a nursing issue. And so we've got to be more proactive as a profession with getting the word out about what nurses have to contribute to various topics. So as Ebola is raging in the Congo, we shouldn't be waiting for it to come here and then figure out who are we going to tell the journalists they should interview, a nurse they should interview about Ebola. We should be doing that work now, thinking if it comes here, we want to be prepared. So to what extent are we thinking about what's the issue of the day that's not necessarily nursing specific, but health and healthcare, and who do we have that can speak on that? And start offering it up, develop relationships with journalists, and offer up nurses as experts. And then finally, nurses, we heard, don't always respond in a timely fashion and to journalists' requests for interviews. And when they do, journalists have mixed experiences. For some of them, they love to talk to nurses because they know how to explain things, as I said, we're so good with the public. Other journalists say we get way too jargony. Now, I think it's probably the more doctorally prepared researchers who get into the jargon. You don't talk about p-values, you don't talk about conceptual frameworks. I'm sorry, they're important to you, but they're not to the public. So how do you frame your work in a way that the public will care about us? We need to develop competencies in media and how to engage the media and how to feel in control of an interview. My colleague Barbara Glickson and I have done media training of nurses. We understand that they have these fears about talking to a journalist. We also understand that they feel like they are not in control. And as nurses, we like to feel in control, don't we? Yes. So we work with them on giving them the tools to feel in control. Now, your organization that you work for or your nursing association may do that media training. So I would say, go ask. If you'd like to do more media, ask, can you get me media training? And then your PR department at your healthcare organization or your nurses association, they would work with you in terms of preparing for an interview and making sure that you're going to be able to do the best interview you can do.
Is that kind of training available online?
It's not good online. I mean, no, and we've been asked, would we put ours online? And there are a few pieces that you might be able to put online, but it is that interactive component. It's being able to be on the spot and know that, hey, I've got tools to control this conversation. I don't have to answer that. Nurses think, so we think that if I'm the journalist, that you have to answer, we think that you have to answer every question that I'm posing to you. You don't. And if you watch the Sunday talk shows, you'll see they don't. They don't answer half the questions that are posed. You just have to be skillful in how do you stay on your message, what you want to talk about, and what are the tools that you can do that. Now, journalists don't like to know that nurses get these tools and are media trained. They want nurses to be their authentic selves, and so do we. We want them to be their authentic selves, but we understand what some of the fears are, and some of these tools can really help you to be more comfortable. I do want to point out that for people who are interested in the preliminary findings, we've got a whole lot of other findings. And that can be found at the George Washington University School of Nursing's website. You can find the press conference that we did on this. You can find the research brief and an infographic with the highlighted findings.
How can they find the nurses?
They do have difficulty finding nurses. They don't have difficulty finding physicians because they're much more used to the physician organizations. They know the physician organizations. They know if they need an endocrinologist, they know the association or the society to go to find that endocrinologist. For nursing, they maybe know the American Nurses Association, but they don't know much beyond that. They don't understand the nuances of our organizations, and they don't know the specialty organizations, which they ought to.
Sounds like we need to build up a network.
Nurses with expertise in all kinds of things related to health. I don't want somebody else to come back in 20 years and to replicate it and find that we haven't made any progress. Let's fix it.